Hello, I'm Dr. Brandon Menke, one of the comprehensive ophthalmologists and partners here at Illumin. I'm going to talk to you about glaucoma. Glaucoma is a very common disease that is typically associated with high intraocular pressure. There are many different forms, namely open angle, closed angle, acute, or chronic, but again, the number one problem with all these different types of glaucoma is having high intraocular pressure. That is what ophthalmologists attempt to lower to minimize the damage to the optic nerve. The most common type of glaucoma would be open angle glaucoma. That would be where the angles of your eye are open, and if you think of your eye as inflated like a balloon, the eye produces fluid called aqueous humor that keeps the eye inflated like a balloon, except there's some outflow tracts in the eye that called the trabecular meshwork that allow that fluid to escape the eye. And obviously, if those channels don't work properly, the pressure in the eye can increase. That's one of the main areas that ophthalmologists target to lower the intraocular pressure, is both the creation of that fluid and also the outflow of that fluid to help maintain a low intraocular pressure. One of the most common ways to treat high intraocular pressure is by using medications or drops. There are many different types of drops, all aiming to help lower intraocular pressure. The idea here is that by using the drops, we can lower the intraocular pressure without doing any surgery. However, there are some cases where further treatment is needed to help lower the intraocular pressure to minimize the damage of the optic nerve, to reduce the amount of field of vision that is taken or lost due to the disease. The first treatment that is typically thought of would be a laser trabeculoplasty. That is where little holes are poked in these outflow channels to help reduce the pressure. This is a procedure that can be done in the clinic. It's typically minimally painful, only with minimal discomfort, and has very good results, typically 20 to 30% reduction in pressure that can last anywhere up to 8 to 10 years in some cases. If drops and laser don't work, the next step in escalating the treatment to help lower your intraocular pressure is doing surgery. One of the more newer things in ophthalmology, particularly with glaucoma management, are procedures called MIGS, which stands for Minimally Invasive Glaucoma Surgeries. These surgeries can be performed at the same time as cataract surgery to help lower the pressure, or other devices or procedures can be done outside of cataract surgery. But these procedures aim to help to lower pressure while being minimally invasive as opposed to traditional glaucoma surgeries. Two of the more common glaucoma procedures, or MIGS, that I perform would be the iStent and the OMNI. The iStent is a device that creates a small bypass channel in that trabecular meshwork, or the outflow tract of the eye, for which fluid can escape to help lower the pressure. This typically has very good results in patients with mild to moderate glaucoma. Another procedure that I use or perform is called the OMNI. You can think of this like a roto-rooter or a snake in the outflow tracts of the eye that helps to dilate that passage where the fluid is escaping, and then also remove the blockage that's been formed or created from causing the glaucoma. Both of these procedures have very good results and again can be performed at the same time as cataract surgery, or in the case of the OMNI, at a different time separate from cataract surgery.